See those okay? Great.
That's perfect.
Okay, thank you. So I'm Sheila, and I work actually for another company called Charlie Waller Trust, which is a charity, and we deliver mental health training mainly to children and universities, schools. But we do have a little nursing arm, primary care arm, allied healthcare professional arm, which is mainly just me. I also do freelance work, so it's in both capacities actually that I'm working with Worth to support them with this project, which is the Severe Mental Illness Health Check Incentive Scheme. So Worth are supporting the delivery of this in a number of ways. So those of you who haven't heard of Worth, they're a limited company and they provide training and research in the field of well-being. So David Smart, who's set the company up, will be joining us later, and he'll be able to answer some of the more operational questions. My role within the project is mainly around the education and evaluation side, though I am involved in most of the project as well, so I might be able to help with some of it. So what is the incentive scheme? So it's been set up to support primary care networks to deliver this comprehensive physical health check. So it's now 12 points rather than the 6, and I will go through that in a moment. And the reason that this has been thought to be necessary is that people with a severe mental illness have a much earlier mortality than the rest of the population. So different research will show different things, but they could die up to 25 years earlier than the rest of the population, which is really not a good thing. They're also more likely to suffer from a number of physical health problems. And these physical health problems in the main and the early death is preventable, mainly due to cardiovascular disease and respiratory disease. So why the health checks have been deemed important is that because these things are preventable, we should, as healthcare professionals, step in to try and support these people to be healthy. So obviously, as you're aware, a health check on its own will not make somebody live longer. It won't make them more healthy. And I think just to bear this in mind all through this presentation, and when you start to deliver the health checks yourself, that the health check is the start of the journey when supporting these people and not the end. So you might have ticked all the boxes, but actually you need to be thinking about how can we keep these people healthy? How can we support them? And that's where some of the difficulty may happen, because I know within a lot of practices you're very busy and you may not be set up at the moment to do that. So this has been set up to kind of support practices to do that by giving a payment. So the aim is that we deliver up to 60 the health checks to more than 60 people, 60% of the people every year. And then that's to be increased by more than 80% of people with severe mental illness by the 31st of March 2024. So it's quite a big ask. You'll see in a moment when I show you where we are at the moment. And the other purpose of the scheme is that obviously you as practices and clinicians and administrators would need to have the education to build your awareness of the needs of people with severe mental illness. And what we want you to know about is how to engage with them, how to help them feel comfortable with participating in the annual health check process, and also how to address any of the identified needs. So that's the purpose of the incentive scheme. So who's included in the scheme? So you've got your QOF registers, so it's the same people who would be on your severe mental illness register, and that includes people with schizophrenia, people with bipolar affective disorder, and people who have any other psychosis. And also any person who's on lithium therapy, because obviously lithium is quite a toxic medication. Important to remember that those in remission won't be included, so those who haven't had any symptoms or contact with secondary care for the last 5 years don't need to be included in this, so they shouldn't be on your register. So previously, the aim was to do 6 checks within the health check. That's in your BMI, so waist and or waist circumference, blood pressure and pulse check, blood lipids including cholesterol, blood glucose tests, assessment of alcohol use and assessment of smoking status. And you can see that though actually are mainly measurements, there's not really any input there. You could do these measurements, that won't make any difference to the person's health. You'll just get lots of good data. So that's what was required beforehand. And I'll just show you on the next graph how we've been doing in Northamptonshire, getting those 6 checks done. So if you look at the grey line on the top, that's the number of people with a severe mental illness in Northamptonshire. The yellow line is the target to receive the 6 points of the physical health check. So that means every person who's had the health check has had all of those 6 measures. So you can see that that's at 60%. And then the blue bars show the number of people who've actually received those 6 measures. So you can see, though we're in kind of increasing, it's still pretty low. We've still got a long way to go. So maybe it's a big ask, but this is why we've got the this project in force to actually try and meet that target with double the measures to do. So these are the 12 measures that are required now. So if you look at the first 6 are exactly the same, so they're the measurements, and then the next 6 are looking at things in a bit more detail, or actually putting in some intervention. So we're going to be looking at their nutritional status, their diet and their level of physical activity, which is something that, you know, we're all doing for our patients anyway. It's kind of bread and butter work for people with diabetes and heart disease. It's nothing new. We'll also be looking at whether they're taking any illicit substances or non-prescribed drugs. We're looking at their access to relevant national screenings, so cancer and screening such as bowels and cervical screening. We know that people with this illness don't tend to take up the screening invite so much. We'll be looking at medicine reconciliation review. This group of people are on a lot of medications which have side effects which can actually affect their cardiovascular health. So that's really important that we're looking at those. We want an inquiry into their sexual health and their oral health. Again, this is another area where this group of people are more likely to be wanting. And then to look at the follow-up interventions that will be required once you've done this health check. So again, just to remember that the health check is kind of an assessment, and then the requirement is that you would follow those on with something else that actually keeps them healthy. So this slide shows how well we've been doing in Northamptonshire with the 12 targets. So the first 6, you can see, if we look at each target individually, we're meeting for most of them the 60%. So for smoking, blood glucose, cholesterol, blood pressure and pulse, those are being done. But if you look at the next box, in the red box in the first part of the graph, you can see that people haven't had all of those 6 measures done. And that might indicate that people aren't having a full health check, that some of these measures being done opportunistically, or that we're not thinking about doing everything when the person's there. And then if we look at the next new 6 measures against the 60% target, some have actually exceeded the target very well, but some are very, very wanting, you know, things like sexual health, for example. And then if we look at having all the 12 measures, you can see that it's very, very low. But again, this is new and we would expect that to rise. as we go forward. So this graph shows the physical health checks by practice. There are some practices missing, so don't worry if you can't see yours there. So the yellow line is the number of people with a severe mental illness on the register, and then the blue bars are the number of patients who've had all the 12 health check elements completed. So you can see there aren't many practices who are near there at the moment. And then this again is looking at the same thing really, but it's looking at how people are achieving against the payment. So if you look at the thin green line at the bottom, 60%, there's just one practice there that's actually meeting the 60%, but nobody's up to the 70% or the 80%. And you can see that there's different payments if you've met certain targets. So if you've got 60% completion, you'll get £110 per annual health check. If we get 70%, you'll get £125 per annual health check, and then it goes up to 140 if you are getting up to the 80. So that's kind of the financial incentive there. Okay, and these are the suggested follow-up interventions. So when you've done your health check, there is an expectation that you will follow through. And this is an exhaustive list, because obviously the health check interventions that you offer will be pertinent to whatever that you find the needs of the patient at the time. So the obvious things are advice and referral for further behavioural support. So things like diet, exercise, smoking, alcohol, sexual health and oral health. And just a point to make that people with a severe mental illness don't do well going to a group if they don't get that one-to-one support as well. So you may want to refer them on to a particular group or stop smoking service, for example, but good practice would be for you to continue to see them individually and to support them in going. There's also the specialised services which you'd use for the rest of your population if you pick up diabetes or alcohol problems or drug problems, cancer. And then obviously looking at the medication, so you might thinking about statins or antihypertensives, but again it could be any additional drug depending on what you find. So the research tells us that people with a severe mental illness do well with behaviour change if they're given the right support. Research has shown they're not offered the right support, so this is why schemes like this have been put in place, because this group of people need extra support than the general population in order to change their behaviour and become healthy, but they can do it if we can help them. So that's really a bit of background about what the project is and what's expected. And so I'm just going to talk about what we're doing as Worth. So what we are doing, we're providing training for clinicians and administrators. We're providing support for clinicians, advice for practices, and also an evaluation of the project. So I'm just going to go through these individually. So the training for clinicians, they need to really attend 2 sessions. So the first one is face-to-face training. So that's to help you understand what you need to do to carry out the health check. So have an understanding of what severe mental illness is, understand how to work with somebody with a severe mental illness, know about the conditions they're more likely to suffer from, what you would actually do in a health check, how you might attract more people to come to the surgery, and with different ideas. So basically, we feel that face-to-face is really important. We're doing very small teaching groups, gives people a chance to talk to each other, find out what other practices are doing, ask lots of questions. Face-to-face training works really well when we're looking at changing practice and helping and supporting people to change practice. So that training is 3 hours of duration. And then there's the online training, and that's to ensure that you know how to code all the elements of the health check into the patient's record. So if you haven't recorded them properly, you won't get the payment. So each payment, each element of the health check needs to be coded into the Ardens system, and that's how it's checked. So if you've just recorded it onto EMIS or System 1 and not on the Ardens, that kind of won't count towards the payment targets. So doing the training will help you know how to do that. So these are the trainers. So these people have been trained by myself to deliver the training. So we've got Lucinda Godfrey, Georgina Callard, Darren Whiting and Fleur Matthews. They have access to me anytime to ask questions. They meet up together with me to provide feedback from yourself. So when they've delivered training and people have put suggestions forward, they can come back and put those forward. They'll also bring questions back. That we've had some really intelligent questions from people who've already been on the training, which they haven't been able to answer, and they've been able to come back to me, and I can answer if I know some. There's been a couple of things that I haven't known myself, and we've looked up, and then we can feed that back. So they're getting lots of support, as I say, from myself and from Worth, and they'll be supporting you as well. And then we've got the training for administrators. So again, this is online, and this is showing the administrators how to ensure all the elements of the health check are completed and coded on the Ardens correctly to trigger payment. So again, they'll be able to support you as clinicians to make sure that you know, you're getting what's due to you if you've done those particular checks. So this is the website that we have, the Worth website, which explains everything in detail that I've just talked to you about, and you can book your training from this site. So that's the address, and you just click on there and it'll take you straight to, we've got an Eventbrite set up, so you can just book yourself onto the training yourself. And then really importantly, we wanted to make sure that everybody's supported. So what we've got in place is that once you've had your training and met your trainer, you can actually go back to them directly to ask them questions if you're not sure about stuff, and if it's something that you're having difficulty with and the trainers can't deal with it, they will bring it back to the Worth team, so that we can look at what issues there are and try and nip them in the bud. So for example, if you're not being given enough time or there's something that you're not sure of, we want to know about it and try and support you to get what it is you need to be able to deliver the health check properly. And I think sometimes this is what's been missing in the past, that you have your training and you have to just go back to practice and get on with it, and we just really don't want that. We want to make people feel that they've got support all the time to do the job that we're asking you to do. Similarly, with other members of the practice team can have information and questions answered by the Worth team, and the easiest way for them to do that is to contact our administrator, who pass whatever the query is onto the appropriate member of the Worth team. So there's a number of us there. We've got people who are, you know, much more knowledgeable about the Ardens, for example, and that type of thing. So and as a clinician, you can also contact Lisa as well if you're not sure about something. We're also providing posters for you to display to your patients with a severe mental illness, and that you'll be able to put up in your waiting room, because what we want to do is for your patients to come in and see that this is something that we're inviting them to do, and it's something that's good and normal to have done, so that you'll get some of those in the post. I think we're sending about 3 or 4 to every practice, because we know that people have more than one waiting area. And we're also really interested to get any feedback for things that we might have overlooked, or things that you think would help you that we haven't thought of. So that would be really great. So again, you can contact the administrator or your trainers, and we'll make sure we'll look at it, and if we can do whatever you've asked, we'll do our very best. And then also we want to evaluate what's happening, because often projects are put in place and we get on with it and nobody ever knows whether it works or not, and we just continue. So we've thought very long and hard about what it is that we need to know, so that we can give people the support and help as we go through. So we want to know whether the people who are delivering the training or assisting the person delivering the training feel that they've had the right preparation and they've been supported in this role. So you will get evaluations to fill out at your training, and you will be asked questions at a later date, and we really would appreciate if you tell us exactly what you think. We want the staff who provide the health checks to understand the needs of people with severe mental illness and know how to deliver the best care for this group. So again, we'll be asking you that at the training, whether the training has covered that. We'll also be talking to your managers to see if they're able to facilitate the delivery of the recommended care. So we at the training will recommend certain things. Is that possible, and what's the difficulties there? So we'll be asking that and looking at how that can be provided. We want to ask staff who are delivering the health checks whether they feel supported to carry out the role. So not just by their training, but by the people around them within the GP surgery. You've been asked to carry out a service. Have you got the right tools and time, etc., in order to do it? So we'll be asking you that. And then obviously we'll be looking at the measurements similar to the graphs that I showed you earlier. We'll be looking at whether there's an increase of each element of the health check being done, whether there's an increase in all of the elements in each person, whether that's been done. We want to find out whether people with severe mental illness who have a health check are actually offered help to change any identified unhealthy behaviours. So in order to do that, we will have to ask the patients themselves. We're still looking into how to do this, because this is quite a sticky point really, in that that's quite time consuming, and practices are very busy. But we're hoping that even if each practice only asked a couple of people to fill in a questionnaire, that would give us enough numbers to get a flavour of what's happening. And also, again, we need to ask patients for this last point. Do they want to engage in the activities to improve their health after they've had a health check? Has that health check kind of motivated them to feel better about this? And again, we can only find that out if we ask them. And given that that's the main aim of the whole incentive scheme, it's really important that we do talk to the people involved, and often that's missed. So that's the end of the presentation. We've got plenty of time for any questions. I'll just end this.
Folks, if you have got any questions, please by all means enter them into the chat box. Also, just to let you know, we've been sharing a couple of links to some of the resources that we have here at the training hub. One of the people that Sheila mentioned was Georgie Callard, who is actually one of our professional nurse advocates, and I've just shared a page about what the PNA role does across county, which also has Georgie's contact details on, if anybody would like to drop her a message.
Yeah, that's great.
We have got a question. With oral care, where would you refer as there's no NHS dentists?
That's kind of a difficult one for me, because not working clinically, being brought as an outsider. So I think that's one for the Integrated Care Board, who's providing this. And I think if there are issues about where to, I think this is something that the trainers are looking into, all the referrals, and they will be telling you that in the training about where people will go. And what the actual services are. As I say, I don't personally know, but if you have your training, they have set up a kind of itinerary of places and services, so that'll be part of your training.
Could I just add, if I may, Craig? The answer to the question is the oral health care. That was a really good question, because the people with severe mental illness have real problem with their teeth, and that's why it's on the chart. And there's a really good campaign called about having a good smile, and people don't go out because of this. The issue is, I then approached, it's centrally commissioned by not by our ICB, but actually NHFT have an oral care service for people who have difficult to reach things. It's actually on the NHFT site. There is a dental and oral care service, and I'm clinical director with Worth, as well as GPA. So I'm supporting Sheila with this. So that's the answer to the question. NHFT do actually have a service. It's for people who can't get their own dentist and can't access dental care, and it's a specialist service, particularly targeting people with severe mental illness.
Oh, thank you, David. I didn't know that. That's really good.
Perfect timing, sir. Another question that's coming through from Maria is, are HCAs expected to carry out these health checks, or is this aimed mostly at qualified nurses?
No, I've been training people for years and years, and I would say the majority of the health checks are carried out by HCAs. I was involved in a big research study in London, the Primrose study, and most of those people doing the health checks and actually the support following the health check, it was mainly HCAs. HCAs are really, really good at this work. Obviously, if you're a HCA, there are elements of the health check that you won't be able to do, such as a medication review, for example. So it is about how you work that out when you go back to practice, and if you're the person, and this goes for qualified nurses as well, or if you're a paramedic or a pharmacist, basically you will look at the elements of the health check and you will do what's within your scheme of competence, and anything else will need to be done by somebody else. So I know that a lot of practices will have a GP, for example, will come in and do the medication review and maybe a care plan, for example. Other practices will have a nurse practitioner who's done a nurse prescribing course and who can do all of it. So it will vary as to your skills, really. But I'd say mainly HCAs are doing a lot of them. Hope that answers the question.
Any more questions? No, it looks like we're clear at the moment.
Craig, could I just ask one question? That if practices haven't signed the Ardens template. I don't know if that was covered, but there are some practices which haven't, then all of them have been highlighted, but that data won't be recorded. And if the data isn't recorded, the practices won't get paid. So that is a key thing for your nursing team just to highlight to the practice manager.
Yeah, I did cover that, David. Yeah.
Thank you.
Quite happy to share a communication out to the practice managers if you'd like, David, on that one. If you want to send me some details and I'll get that out.
I've just seen another question. Are we supposed to have training before carrying out the checks? I would say that you would feel more confident if you'd had the training, and it would be good to have the training so you can kind of start as you mean to go on, and you're not maybe having to go back to patients. So you don't have to, but I would suggest it would be a really good idea. There is training there for you to be booked on. It just will make you feel more confident, I think, and have a better understanding of what needs to be done. Thank you. Maybe I could ask how people are feeling about this. People excited, unhappy, happy, flat? Be interesting to get a feeling about, you know, I know it's another job for people to do on top of their already busy workloads. Yeah. We hope the training won't just fill you with confidence. We hope that the training is designed to actually make you feel quite motivated. And I think that's the difference with face-to-face training and this kind of online stuff, that, you know, you go and meet a trainer who's really passionate and kind of really will make you understand what's going on. So that, you know, that makes you feel when you go back you want to change things, and not just do something that you've been told to do. How long would I oh, so people haven't been told. That's maybe all your practice managers will be getting an email all about this soon, and they should know about it anyway, but they'll be getting an email with a survey and posters and leaflets. So right, so the appropriate amount of time, it depends really on how you set up your clinic. If you were going to do everything all at once in one appointment, I would suggest about 45 minutes. If you're going to maybe separate it and you're not doing all the health check, then really you would shorten it accordingly. So if you were doing most of the health check and then a GP was doing bits of it, you might only need 30 minutes. So again, it's kind of a bit of negotiation. Yeah, so somebody said GPs do the medication and I do the health check. So that sounds a good balance. Yeah. Have I missed any questions on the chat? I'm not very good at watching them coming in. It is so.
Did we get the one about length of time for a standard appointment?
Yes, I answered that.
Yes, sorry.
Yeah. The Ardens template's very long. Yeah, that's because the health check's quite long, and I think if you know what you're doing, it should be quite simple to fill in. The trainers, even though you get separate Ardens training, the trainers will kind of show you it as well in the context of doing a health check, so that will be helpful. So I think you will all feel better once you've had the training, even if it's just to confirm that you're doing everything right. So you've missed the advice on getting a dentist, so see if I remember what David said. If you go onto the NHFT website, there's all the details there. They've got a specialist service that you can refer people to. So quite simple, really. Any other questions or thoughts? If you think of anything afterwards, or there's something you want to ask that you don't want to ask in front of people, if I'm happy for my email to be shared, and people can ask me individually. I'm really happy to answer individual queries, and if I can't answer them, I'll ask David. So where do we access the training? So I put up on the, shall I put this, I'll put it up, I'll put the slides back up and I'll show you. I
have put it in the chat as well. It is in the chat higher up.
Is it? Oh, I've closed it now. So.
Sheila, just a thought, would it be possible to send me a copy of the slides and I'll distribute them?
Yes, that's a great idea. Yeah, and then you'll get it. So the website's there with the website address, all the details. And again, we're happy for you to contact us with any queries.
Brilliant. Yeah, I'll definitely. Thanks for the question, Elizabeth. We'll make sure that the slides are distributed. Okay, perfect. No problem. Fantastic. Thank you very, very much. Very
thank you, everyone, for listening.